Okay, this is Victoria from V Health CEO. I just want you to go through the most common questions and the ones that people ask. What are the steps?
Well, thank you, Judy. The steps that you have to take as a foreign graduate, excuse the noise, is number one, you must be a registered nurse in your country, Kenya, Tanzania, Nigeria, Uganda, Namibia, Ethiopia. You have to be registered with the Board of Nursing. That is the only way you can be eligible to take the American Professional Nursing exam. And once you have done that, you'll be required to apply to them. You'll be required to do your CES, Credential Evaluation Service, and this is through CPFNS. And also, you'll be required to take English. The English is really required, but it's also not required before you take the exam if your country is an English-speaking country. And basically, that's it. The process can take about 6 months to 9 months. But the issue is African nurses have difficulty passing the exam simply because.
Why do you think that is the why do you think African nurses have difficulty passing the exam, Victoria?
Well, number one reason is because the culture is different. African nurses, they are great nurses. I trained in Africa and came to United States. So change in the culture, the way we do things in Africa is really different from the way we do it in the United States. Number two is your English. Your English really needs to be at par because you have to understand what the questions are asking. Number three reason is we don't know the examination technique of NCLEX. In Africa, we're used to essay writing. In the US, it's computer adaptive test and it's multiple choice.
Can you go through some of the basic principles of NCLEX? I think we have about 13 principles. Can you go through some of them really quick?
Thank you. Some of the basic principles of NCLEX, I'm writing a book now, which I call you have to be a master. In other words, you need to be proficient. You need to be proficient in these things. Number one, master of self-discipline. For you to pass the exam, you need to be self-disciplined. You need to allocate time. You need to be a master of privacy. In your NCLEX exam and in patient care, we take patient privacy very important. We have HIPAA regulations, privacy in the hospital, very, very important. Also, you have to be a master of infection control using your hand washing and those kind of things. You are responsible for making sure the patient is safe. Then you have to be a great communicator. You have to be a master of communication because in America, we do communicate a lot with the patient. That's just a few. When you come to the class, I will go through all of them.
I just want to highlight that I'm master of communication, and I want to say one of the things I noticed with communication is also Africans not being able to listen and read instructions and comprehend, because we get so many people asking the same thing when some just asked before. And these are the techniques we're going to teach you when you come to the class, so when you come to America, you're going to be successful. Thank you so much, Vicky.
Thank you.
Please sign up, and we hope to train you and become the best American nurse.
American nurse.
Welcome to America, nurses.
Welcome to USA, Loma Linda, California.
Thank you.